Hello everybody, welcome to my YouTube channel. So today onwards I am going to give explanation about oncology clinical programming, 100 advanced and complex interview questions along with the answers. So nowadays everybody, when the freshers or who are having the less experience and more experience are very much struggle to crack an interviews, especially in the oncology therapeutic areas. Why? Because they have lack of knowledge and even some resource already worked on the oncology, but they can't remember what the things they have worked on, as well as they are not having the proper knowledge on the topics which they have already worked on. So here, so this 100 interview, advanced complex interview question and answers will give more information about the oncology, as well as it is easy for cracking the oncologist interview. So the first and main question they will ask you, what is the RECIST? So which version you are using? 1.1 version we are using. So what is RECIST 1.1? So RECIST 1.1, it is a standardized method used to measure how the tumor responded to the treatment. So whenever we are giving some treatment, oncology treatment to the subject, so what is the use? So the tumor has to be respond, either it is decrease, either increase, either stable. Some response is produced by the tumor, right? So even if so many CROs, they're following a different standards to evaluate these responses, and if they are not following the standards, so every time they go with the responses to the FDA or other regulatory, they will having so much time to take the review the responses. So for that purpose, this resist, it is measure maintain a standardized method how to calculate or how to measure the responses given by the treatment. So by tracking the changes in the lesion size the over time of the treatment, so it will help to categorize the subjects into four main categories: complete response, partial response, stable disease, and progressive disease. Okay, so here these are the some standard rules which we can see in the RECIST 1.1. So target lesions, non-target lesion. So target lesions nothing but whenever you are able to measure some tumors, we can call it as target lesions, and whenever we are not able to measure, so those are non-target lesions. So as per the RECIST 1.1, so the target lesion should be 5. So we have to, at least we have to calculate, or we have to identify the 5 total lesions. So max per 2 organs. That means, so one organ you are not going to take more than 2. So for example, you are found some tumor on the liver. So two tumors you can take from the liver, and so some other organ you will select the one, like that. Total 5 targeted lesions we can take. Okay, this is one rule. So example, 3 lesions in liver, 2 in lung, total 5 target lesions. Okay, non-targeted lesions are not measured in the size. For example, it is there in the blood, and it is there in the some specific or sensitive space of the body organs, like inside the heart, like that. So we can't measure, but we can feel that whether it is a present or not. So lymph nodes present but not measured. Okay, well, WBC cells and some other cells, the tumors are present but we cannot measure. So next, baseline sum of the diameter, SOD. So the sum of the longest diameter of all targeted lesions at baseline. So we have to measure each and every tumor sizes. So shortest diameter, longest diameter, the tumor, so if you are measuring the perpendicular, shortest, and so longest, and if you are measuring, up to down, so it is a shortest. So we have to measure each and every tumor. What is the sum we have to measure? So example, lesion 1 is 30 mm, lesion 2 is 40 mm, baseline SOD is 70 mm. Okay, sum of these two lesions. Percentage change, nothing but used to determine the tumor was reducing or increasing or stable. For example, the tumor is of 70 mm size. after giving the responses is 30. So that is 40% of decrement is there. So that is a partial response. If it is completely removed from the body, that is a CR, complete response, like that. So current SOD minus baseline SOD divided by baseline SOD into 100, it will give you the change and percentage. If it is at 100, it is a change. If it is into 100, percentage. Complete response. When we can call it as a complete response, disappearance of all targeted lesions. For example, 70 size is there. After few days, if you are measuring the tumor size, if it is completely disappear, that response we can call it as CR. At least 30% of the decrement of the size of the tumor, we can call it as partial response. And the partial response. And here progressive nothing but in case of instead of decrement increasement happen, so 20% increment at least, so we can call it as progressive disease. So 60 is there, so after few days instead of decreasing 75 what was happen, so that is a progressive. Stable disease, neither PR nor PD, so we can, it is a stable, right? So that type of response we can call it as stable disease. New lesion appearing. So for example, in the liver, so initially you found only two tumors, two lesions, but after few days, three lesions were appear. So that means what? So some new lesion was there. So always consider PD, because if it is a progressive, then only the new lesion was appear, right? So the disease was increasing. So if new lesion was occur, that means that is a PD, progressive happen of the disease regardless of the tumor size. New lung lesion, that is a PD. So non-targeted lesion. So targeted lesion and non-targeted. Non-targeted lesions are not able to measure, but if they are present, so we can include those are present or options. Okay. And next here some example for giving a more understanding about the RECIST guideline. So 101 and 1002 subjects is there at the time of baseline, means before giving the treatment of oncology. So the tumor size is 100 After week 6 of our treatment, it was 70 and week 12 it was 0. New lesion, no new lesion was appeared during this period. So that is something 30% of the decrement was happening at the first, so PR, and 12 weeks, so completely zero, that is CR. PR response go to the CR response. Finally, it is a CR response. 1002 subject. So at the time of baseline, it is 120 size. After week 6, 8% of the decrement. After week 12, 125% of increment happen. So first it will decrease, after it will increase. So stable disease, it will go to the progressive disease. So the disease was progressive. So do a last best overall response is first one is CR, second one is PD. Okay, so second one is SD, sorry. So first stable disease, next PD. So the best response is SD. Within these two are what is the best response? We can see PR or CR, CR is the best response. SDR PD, SD is the best response. Okay. So quick summary table, you can see CR, all lesions were disappeared from the body. PR, at least greater than 30% of the decrease from the baseline. Stable disease nothing but between the minus 30% decrement to plus 20% increment. We can consider that is a PSD. Okay. So PD nothing but greater than 20% of the increment, smallest value or new lesion. Okay. So how to explain to the interview about this question? RECIST 1.1 is a guideline, helps to define the tumor response using the measurement at the baseline. We record the tumor size, means before taking we measure the total tumor size, then comparing the each follow-up visits and find out the percentage change. Depending upon the change, we can calculate the whether it is a CR, PR, SDR, PD. Okay. If the new lesion was appeared or existing one increasing greater than 20%, it is a consider as the PD. These rules were applied in a ADRS dataset. ADRS dataset to derive the visit-wise best overall. So finally, it is not a dataset. This is not a has dataset. It is a set of clinical rules and guidelines like a rule book. It is used to assess the tumor size, tumor response in oncology study. It tells to how to interpret the tumor measurement collected from the imaging data. Think it's doctor measure the tumor, RECIST 1.1 apply the tumor size decreasing or increasing. SAS programmers are applied these rules to derive the standard variables in the dataset.